Hey friends, welcome to my channel, Life with Everyday Haley. And today I have a chronic endometritis update for you. This is a long one, so buckle in and just hang tight for the ride. What a circus this is. So I just want to start by saying I haven't updated in a while, and it's not because I don't want to update, it's because things move at a turtle pace in the world of chronic endometritis and fertility treatment. And every day I feel like I learn something new. So I didn't want to come on here until I truly got a good update for you. So if you followed my journey on my channel, I am a girl in a fertility battle. I come on YouTube to share my journey so that you can learn, think about what I'm sharing, and hopefully it can help you on your journey. If anything, just to know that you're not alone and that somebody else has been through this, and I'm not giving up, and I'm not giving up hope. So go to my page to watch my first chronic endometritis updates. So I'll pick up where I left off. So I did do 2 rounds of doxycycline and flagyl and a Rocephin shot for my treatment of chronic endometritis. It did not work. I had a third biopsy about a month ago, and it showed 7 plasma cells. So I'm still positive for chronic endometritis. It's lower than when it started, but not much. I started with 9. So my body's just barely making any progress. And my culture results are just all over the place. So let me just give you a brief rundown of my history so that you can understand if you haven't seen the previous videos. I've had 2 back-to-back miscarriages right after each other. So I can conceive right after I started trying to conceive. So it was quick, and it was terrifying, and it was horrifying, and it was very quick. I put a total pause on trying to conceive after that because I was like, what is going on? I had a missed miscarriage. It was very unexpected. Something went very wrong very quickly with my pregnancy, out of nowhere, and it was very traumatic. Whew. So I was like, I'm okay, that's it. I'm investigating. So I started down the investigative journey, had to totally self-advocate, had to do that myself. My OB did not recommend any type of testing for me. I had to ask for anything I got done because it was only 2 losses, But I was just like, y'all, I've got rheumatoid arthritis. I feel like this is not back to back like that. Something's just not right. I just had a feeling. You should always follow your gut. So I had to self-advocate. Luckily, a lot of these fertility clinics and places, you can schedule your own appointments without a referral needed. And I did that. And through testing, I tested positive for chronic endometritis, one of the only things that my testing showed. And what is chronic endometritis? It is an inflammation of your intrauterine lining. That's where your pregnancy grows. And chronic endometritis is a chronic low-grade mild inflammation, usually caused by a bacterial infection or microbiome imbalance. Oftentimes, it can be like an imbalance in your vagina, and then that bacteria leads into your uterus. You can also get it from D&Cs or miscarriages, procedures, so anything in the uterus that can stir it up and cause it to have issues. So my first culture showed rare mixed positive bacteria. So there was some bad bacteria in there culturing. Second culture showed, after the antibiotics, showed no more bad bacteria, but it showed still I had 6 plasma cells, which is very low, very, very mild chronic endometritis, but it's there. And then I did another round of the same antibiotics because I think the doctor was thinking, well, she responded to this round, which again was doxycycline twice a day for 2 weeks, flagyl twice a day for 2 weeks, and a Rocephin antibiotic shot both times. I did that again, going through all that antibiotic treatment was a nightmare, but I did it. I'll do what I have to do. and I did another biopsy in my next cycle, and it was still positive for chronic endometritis with 7 plasma cells. So actually more than 6. I had 7, and that really shocked us. We weren't expecting that. We didn't understand. That was really hard. And I've been very disappointed because my doctors haven't been able to give me much of an answer. And that makes me really discouraged. And it's also not good for women in this space to feel so much anxiety because we're already struggling with grief. We're already struggling with this treatment, these biopsies, and I'm just getting a lot of vague feelings. I'm getting a lot of feelings of they don't know how to help me, and feelings of I'm a lost cause. And I don't know why I'm feeling that way, but I try to send messages to learn about what's going on, and I just get very vague responses. I've been doing my own research and talking to other doctors, by the way, which I always recommend you do. And I've been learning along the way. So my doctor that I am seeing did put me on 3 weeks of doxycycline and a clindamycin vaginal antibiotic cream that typically is used to treat bacterial vaginosis. I've been researching on that. So I did that cream, finished that cream, and she wants me to do another Rocephin shot. And then after that, we're going to re-biopsy me and see what's going on. So more antibiotics. And I'm okay with finishing up this course because I kind of I want to finish it to see if it will help, if the doctor thinks it will help. And that's kind of where we left things. Again, I'm not feeling the support that I feel like I deserve as a patient, but I did get a second opinion about my case. Again, I'm still taking my antibiotics. I'm going to finish this round, but I did get a second opinion from a fertility doctor that I had already established a relationship with prior. So side note, we did meet with an IVF doctor when we were having our losses just to see, do we need IVF? What do our next steps need to be? And thankfully we were told, no, I wouldn't recommend IVF after the losses that you've had, and I would continue to try naturally. So that was good news for us. We were turned down basically by the IVF doctor, but he was very supportive and caring. So I reached out to him again because he had also recommended that I get tested for chronic endometritis. And he had shared with me originally that he does not culture for bad bacteria, and he treats with, doxycycline, and it's not a big deal, nothing to worry about, and treat it and then try to get pregnant. And that was his perspective in the very beginning. So I got with him again. I really respect him again. And I said, what do I do? This is where I'm at. I've been waiting 3 months now trying to clear this, and we can't get rid of it. Am I doomed, for pregnancy loss? Is that all I'm going to face? And he had a totally different perspective than the other doctor. And he was like, this is a nothing burger. That's what he said. And he was like, you've just wasted time. You've treated it with antibiotics. There's no scientific proof that you're going to have loss from this. And so there are a lot of doctors that feel that way. And there are some doctors that feel like if you have under 10 plasma cells, it's nothing to really worry about as long as you treat the bacteria. There's some, my doctor was telling me, if I have under 5 plasma cells, we will not even treat this anymore. So that was a really, really good perspective. It did give me hope as well. Because I told him I was really feeling and I'm not going to be able to have success. I just didn't know what it meant. Share my honest experience as a patient to educate women out there going through a similar struggle. Because in this space, all it is self-advocation. That's all it is. And you have to fight for yourself, and you have to have a mindset of, I'm going to hear something different from 4 doctors. I have to try to figure out what I think is best for me in my walk in this journey. I've been in this space of 3 months of treatment and biopsies and intense mental and physical pain, and it's a very dark space, and going through that over and over, that cycle of bad news, testing bad news has really just like made me feel like there's no light at the end of the tunnel. When you go through something like this, like you just get in this headspace of like, this is not, like, I'm not going to be okay. And it's really hard to like zoom out and see the bigger picture of like, there's no way I'll be in this spot forever, but like it feels that way. So anyways, again, I can't even believe how big of a deal this is or has become, because it's 7 white blood cells in my uterus that they see under the microscope. And if, like I said, if I had 4, they wouldn't care. So it's like this huge deal in my head and in my life over really like a very small thing, but it's something we need to fix, and it can be hard to fix. So it's just a really big like mind game. But anyways, so that doctor did give me that advice. Very kind physician. I really appreciate him. He's always kind to me when I have a question. And I told him, I keep coming to you because I trust you. And I think you're really intelligent. Like, I've told him that, and I do. There's something special about that doctor. So moving on from that, I got a third opinion, which I'm really proud of myself for doing all of this. So this gets us into a whole new realm of fertility care that I am seeking the new doctor in reproductive immunology. And I'm going to do another video about why I chose that path. So hang tight for that video. But I'm just going to share with you what he said to me about the chronic endometritis, since this is a video about chronic endometritis. So I saw a reproductive immunologist. He specializes in reproductive immunology, so the study of your immune system and how it impacts pregnancy or pregnancy loss and things like that. And as you know, I'm a woman with an autoimmune condition that has had recurrent pregnancy loss issues. So he's a good fit for me. But what he shared with me about the chronic endometritis is it's definitely a problem. We need to figure out how to treat it and get rid of it, clear it out, or what's causing it, for that matter, what's causing it. And so he is evaluating. So first of all, he told me that my fertility doctor did not follow the CDC guidelines for treating a patient with chronic endometritis. The recommended treatment course is doxycycline for 2 weeks. If that does not work, it's flagyl and ciprofloxacin for 2 weeks. So that's their recommended course of treatment. So I trust him. And he's like, finish your antibiotics right now, which I'm currently on 3 weeks of doxycycline. And they want me to get a Rocephin shot. And they did 2 weeks of clindamycin vaginal cream, which ended up only lasting a week. Like there wasn't enough. So I did that. So that typically treats bacterial vaginosis. Then he wants me to do another biopsy to check to see if the treatment worked. And he wants to add, addition to the bacterial cultures, he wants to add a test for a virus that can live in your uterus that could be causing the inflammation. So I haven't been tested for that. And he's like, let's test you for that to make sure, because your treatments wouldn't have helped with that. And I was like, well, thank you, because you never know, you never know. Tested for it. So that is a chronic endometritis update for you. So I am just moving through my treatment, waiting for that next biopsy. Probably will be in July. It will be in July. And honestly, I'm going to take a month of a break. My body's tired. My uterus needs a break. And I'm going to pick it back up in July. And I am just praying to God that my plasma cells are gone. And another reason why I chose to see a reproductive immunologist is my cultures are saying no bacteria. Does that mean the bacteria is gone? Why am I still having inflammation? So we got to figure out why. And so I think this doctor can help me figure it out, or help me come to a resolution with it, because I've been dealing with this for 3 months. I am ready to shut the door and say goodbye to that. and figure out how to move forward. So that is my chronic endometritis update. Is it what I wanted to hear? No. Did I respond to treatment the way a lot of patients do? No. Um, do I have a stubborn case? Yes. But there's women like me out there, and there's not a lot on the internet about this or on YouTube. And so I wanted to share my story because I can't be the only person that's ever been in this situation. And the Facebook group for chronic endometritis, the endometritis Facebook group, there's all kinds of women that are in my shoes or have had treatment for months and multiple biopsies and go through this, and it's blindly treated and it's not effective, and it's traumatizing, it's painful, it's delays in your journey of wanting a family, and it's hurtful, it's heartbreaking. I am totally content and very positive for the future. But my journey has not been easy, and I consistently hear from women in this space how they have to self-advocate, they have to do their own research, they have to ask their own questions and really try to advocate for themselves. And you have to be your own supporter. You have to believe in yourself first. And I don't know why that is. But my biggest piece of advice, if you're in this and you're dealing with a lot, get a second opinion. Get a second opinion. I found a doctor on Instagram. It's a really well-known endometritis physician. So this would have been my fourth professional opinion on this. And he had shared that he thinks that, yeah, I need to figure out why these plasma cells are there. I need to clear it appropriately. And he told me that cultures are totally inaccurate, and a totally inaccurate way of diagnosing this and trying to figure out what the bacteria is. So, yep, do your own research. Think about it for your own self. I mean, I wouldn't know half of what I know today about this if I did not research it myself. I will probably update again after that next biopsy when I know what my results are, what the heck is going on, and we'll go from there. I wish I had better news to share, but this is an honest testimony of a patient that is really struggling to get rid of chronic endometritis and not really understand what's causing it yet. So thank you for tuning into my channel and watching this video. Keep looking for another video I'm going to post on reproductive immunology, what that is, how my journey went to finding that physician and establishing care with that physician. And I'm really excited to bring that to you guys because I think it can be valuable. Thank you so much for watching my channel, and you'll have a blessed day.